Yeah. So we performed the SCOUT HCM trial, which is a prospective randomized controlled trial of mavacamten, which is a myosin inhibitor in pediatric patients with symptomatic obstructive hypertrophic cardiomyopathy. These were adolescent patients that have hypertrophic cardiomyopathy and a significant amount of left ventricular outflow tract obstruction that was measured with a Valsalva, the so-called Valsalva left ventricular outflow tract obstruction. And patients were randomized 1-to-1 either to receive mavacamten or placebo. The primary endpoint of the study was a reduction in the Valsalva LV outflow tract gradient at 28 weeks, and we saw a pretty dramatic reduction in the amount of obstruction. In fact, most patients that were treated with mavacamten had a reduction below which that we typically would consider to be obstructive at all. We also looked at a number of key secondary and exploratory endpoints, including the maximal left ventricular outflow tract obstruction gradient, some markers of diastolic function, some biomarkers of injury to the heart, as well as symptom scores in NYHA, New York Heart Association functional class. And these were all significantly improved with patients who received mavacamten compared to those that received placebo. So we were very excited and encouraged about these findings. Yeah, so I think we're seeing real clinical benefit here. These myosin inhibitors are the first medicines that we have that are really targeted for the underlying pathophysiology of the disease with hypertrophic cardiomyopathy. Prior to this, what we use for children is really aimed at helping their symptoms, and it's not actually based on very strong evidence that they're helpful in pediatric patients. It's really extrapolated from what we do for adult patients, and the effectiveness is questionable of how helpful these medicines are. So to see such dramatic reductions in the gradients that we saw, as well as the improvements in the secondary endpoints, is really encouraging. I think this has the potential to fundamentally change how we treat these patients. That's a great question, and I think we really need long-term data to know that. It's certainly very encouraging that we saw the wall thickness improve, these biomarkers of natriuretic peptides, which were markedly high, improved dramatically, similarly with troponin levels and degree of mitral regurgitation. So I think it's hopeful that this is changing the natural history of the disease, but it's important to keep in mind this is a relatively small study. Follow-up was only at 28 weeks, and so we really need long-term data to know how well these hearts are doing with mavacamten. Yeah, the symptom score that we use, unfortunately, is not validated for pediatric patients. We don't have a validated score, which is certainly a limitation in our field to be able to track that and see how patients are doing over time with medications and just in general. But these patients were fairly limited when we look at their exercise data. The VO2 levels, the peak oxygen consumption levels were relatively low. And so we certainly feel that these patients are limited based on their outflow tract obstruction, and encouraged by the results that we saw that we're seeing a meaningful improvement in these markers. I do think there are good markers of disease and have important prognostic implications. If we're able to see sustained reductions in natriuretic peptide levels and troponin levels, I think we are likely changing the heart favorably, that we're seeing favorable remodeling, and potentially could really benefit these hearts in young patients that would otherwise be exposed to the relentless damage that can happen with the severe amount of obstruction over years and decades. Yeah, it's a great question. The study was small, so it's hard to do an in-depth analysis of certain subgroups. The gradients that we saw were overall pretty high, and importantly, there was really no safety issues. The overall adverse events were very low, and they were well balanced between the placebo group and the mavacamten treated patients. No patients had a decrement in their ventricular function, lower than an EF of 50%. And so there was really no concerning safety signal. So we think the medication can be used safely in patients with, pretty significant disease. But are there patients that may benefit more than others? Absolutely, that may be the case. And I think we just need, further study in larger populations over longer periods to try to sort that out.